Yes, so before Clinic First, we, as residents, had to balance kind of an inpatient and outpatient rotation. So while you're juggling patients in the hospital, you would also have clinic and worry about your clinic patients. And that can be quite straining at times. So our Clinic First, which started this past year, tried to separate that and relieve some tension that residents were feeling, so they could focus. While they're in the hospital, they're focusing on their patients. And then when they're in clinic, then they can focus on their clinic patients. And I personally, that's a world of difference living in both worlds. So that is another big draw to come to our program, because not many other programs have that clinic first mentality, and you will have to balance both worlds. It relieves some tension that I would feel when I'm trying to care for patients in the hospital while I was in clinic. Like, I would care for people in the hospital in the morning, and then if something would pop up, and it usually did while I'm in clinic, it was just very difficult to balance those and feel like I'm giving 100% to both patient cohorts. So living that world, and then now as a third year, I mean, we become more efficient as we go through the program, but I feel like I can stress my energy on the patient in front of me and not have to worry about my hospital patients, now that we have kind of separate rotations, specifically for clinic or specifically for your rotation. Another thing that would kind of get in the way, not necessarily inpatient and outpatient that you're caring for, but if you're rotating with a specialist, a cardiologist, urologist, et cetera, before Clinic First, we would have to have clinics interspersed in that rotation, and it would be very haphazard when we would see our specialist and learn from our specialist. So now it's a whole 2 weeks you're with that specialist, and it's not as choppy, and they appreciate that you're there every day, whereas, before we would be off to clinic or off to conference, and they wouldn't see us for a day and a half type of thing.